Hi, my name's Christy. Today I'm going to be teaching you about breast cancer. Some of the things that I'm going to want you to learn from this lesson are going to be ways that you can reduce your risk for developing breast cancer, some of the signs and symptoms of breast cancer, and also I want you to understand the importance of breast self-examinations and how to correctly perform one of those. So let's get started. The first thing that I'm going to do is pass out a few handouts to you. They're basically going to give you a list of the signs and symptoms of breast cancer and the risk factors for breast cancer as well. Just to go over, some of the signs and symptoms are going to include a lump or a hard knot in the breast. Maybe you'll have some localized pain, some redness, swelling. You could have some dimpling or puckering of the skin in the area. Any discharge from the nipple, that's a red flag. You could have inverting of the nipple. Basically anything that is not normal for you, you would definitely want to get checked out. Risk factors. These are very, very important for you to know, okay? We're going to start out with your family history. Has your mother ever had breast cancer? Has your grandmother ever had breast cancer? Has your aunt ever had breast cancer? These immediate family members right here are going to tie in very, very much with the risk for developing breast cancer. Okay, next is going to be your genetic history. If your mother has had breast cancer, it's very likely that she may contain the gene for the BRCA1 and BRCA2. Okay, if she's had breast cancer, you might want to look into getting her genetically tested and see if she holds those genes, because those genes are known to cause breast cancer. And if she has those, it's very likely that she's passed it on to you. And these are things that are definitely going to increase your risk for developing it. Women age 55 or older, you're at an increased risk. Your race or ethnicity. White women are more likely to develop breast cancer. And African American women, they develop it as well, just not as often. And when they do develop it, it actually turns into a more aggressive type of cancer. So those are things that you need to know. Hormone therapies, such as your estrogen and your progesterone, combined therapies for postmenopausal women, these increase your risk factors. Exposure to chemicals. We have chemicals in our water, in our cosmetics, in BPA plastics, anything with BPA, your grilled and prepared foods, lawn and garden care, exposure to pesticides. Pesticides have a lot of chemicals in them. These all increase your risk factors. And there's also, if you have dense breast tissue, that can increase your risk factor as well. We're going to do a little learning session here, little activity. We're going to write down 3 risk factors that you may personally have and identify them. And then we're going to identify ways that you can reduce those risk factors. And then here, just a few questions. Why might you think that postmenopausal hormone therapy would contribute to the development of breast cancer? And the answer to that is just going to be a combined estrogen and progesterone can increase your risk by about 75%. And that's a lot. It's also said that women, once they stop taking the combined therapy, that their risk is going to go back to that of a normal woman's that is not taking it within 5 years. And the reason for this is because a lot of our tumors that develop into our breast can be estrogen fed. So when you're giving yourself these hormones, your tumor is just basically feeding off of it. It's just feeding off of that hormone that you're taking, and making it increase its size, increase its aggressiveness. And these are things that you need to talk to your doctor about, and decide if that's something that you'd be willing to do. Do you think that a woman as young as 27 could still develop breast cancer, or do you think that it's just biased to women 55 or older? Women as young as 27, 22, you know, it's not biased to any age. I had a friend just last year that developed breast cancer at the age of 27. She was sitting at a stage 3. She's now went through chemotherapy and she's doing much better. But that's just come to show you that, you know, any woman at any age, any race, any ethnicity, you can still be at a risk for developing breast cancer. And that's why it's important for you to know your own personal histories and risk. Do you think that you could experience no signs or symptoms if you were developing or currently had breast cancer? You could not experience any signs or symptoms. There's a possibility that you could have breast cancer and not even know it. And that's going to be another reason why it's so important that you perform your breast self-examinations every month. And another reason why you should know your risk. Do you know what age you should begin receiving mammograms if you have a family history or if you don't have a family history? Any woman should start receiving her mammograms at age 40. Okay? Women that are at an increased risk, such as they have, their mother has had breast cancer, you should start as young as 30. Why do you think that certain chemicals and other environmental factors would have an effect on your risk for developing breast cancer? This is what we were talking about earlier. There's certain chemicals that have estrogen-like properties. And that's, you know, ties back into the hormone therapy type stuff. You know, tumors can be estrogen fed. So it's important for you to read your labels and know what products have these certain chemicals in them, like BPA. BPA is a synthetic estrogen. BPA is lined in some of our plastic bottles, and you should check with your recycling center and see if the type of water bottle that you are drinking from has BPA in it. You should check your canned food items. Some of those have a lining of BPA in them. And there's actually a website out there. It's called the Environmental Working Group. Check it out. It's got a list of chemicals and what's in certain products. So again, read your labels. If you find yourself at risk for developing breast cancer or you display any signs or symptoms, you should immediately call your doctor. Get in touch with your gyno. Get a close relationship with them so that way they know your risk factors, you know your risk factors, and if something develops, you can immediately seek the treatment that you need. And now we'll take the time to just go over some of those risk factors that you had written down and ways to reduce those. And I'm going to allow some time for extra questions. All right. There's some statistics. In 2014, we have an estimated 40,000 women will die from breast cancer. Okay? And you've got a couple different types of breast cancer. You have invasive breast cancer. And these cancers are the ones that basically move around. They invade all different types of areas. They can move into your lymph nodes. And once it gets into your lymph nodes, it can move through your bloodstream. And you can start out with breast cancer and you can end up with brain cancer. Okay, so it's very important that you know what's going on there. And for 2014, there's going to be an estimated 232,670 cases of invasive breast cancer diagnosed. Okay, and then we also have in situ breast cancer, and that's going to include our DCIS and our LCIS. Okay, and there's going to be an estimated 62,570 cases diagnosed of that type of breast cancer. Just to let you know, in situ means it's basically where it was born. Okay, so when you have your DCIS, which is the ductal carcinoma in situ, that means that the cancer, the abnormal cells, are just basically developing in your milk ducts, and they don't normally, you know, move off from that. They stay right there in that localized area. And then you have your LCIS, which is your lobular carcinoma in situ. okay? And that's where those abnormal cells, they grow inside the lobules of the breast, okay? But with the LCIS, that has an increased chance that it will turn into an invasive type of cancer, or that you could later on develop an invasive type of cancer. All right, so next I'm going to go into the importance of a breast self-examination. Just to give you an idea of what a breast self-examination is, it is exactly what it sounds like. You're going to personally examine your breast. You're going to feel it. You're going to look at it. You're going to learn what your breasts look like, feel like, and everything, okay? There's about 5 basic steps for this. First off, I want you to look in the mirror. I want you to visualize your breast. I want you to take in the size, the shape, the color, the evenness, the unevenness. Is one nipple out? Is one nipple in? Whatever your breasts look like, I want you to learn it and know it, okay? Next, you're going to raise your arms, all right? You're going to look in the mirror and you're going to visualize what your breasts look like when your arms are raised. You're going to take in all the same factors, okay? And you're going to log them into your memory. Next, you're going to lie on your back, all right? And you're going to use the pads of your fingers with a firm touch, and you can either go in a circular motion or a vertical motion. Whatever is easiest for you and whatever allows you to feel all of the depths of your breast. You want to be able to feel the entire thing, okay? You're going to uncover the whole area. You'll start at your collarbone, okay? And you're going to move all the way to the top of your abdomen, filling each area in a pattern, all right? And next you're going to go from underneath your armpit all the way over to your cleavage, all right? You want to make sure, like we said earlier, that you're checking the lymph nodes as well, because your cancer can move there and you may possibly not be able to feel the lump in your breast, but you could feel it in your lymph node. And you know, once it's moved there, you really need to get it treated, okay? And the next step is going to be to sit up or to stand and repeat the steps from the previous one. You know, you just feel it, the difference in the way it feels whenever you're sitting up or standing. When you're doing all this, you want to also check and make sure that you don't have any fluid or milkiness, anything like that coming out of one or both of your nipples. The next learning session or activity that we're going to have is going to be, I'm going to hand out some silicone models of breast. And this is going to help you to distinguish the difference between a healthy and an unhealthy breast. It's going to help you to distinguish the difference between what just a simple cyst would feel like or what an actual breast cancer lump is going to feel like. And it's also going to help you practice on your technique. I'm going to walk around the classroom. I'm going to help you get your technique down to a T. I'm going to answer any questions that you might have. Do not be afraid to ask me any questions. I'm here to help you. I'm here for all that. And I want you to understand that doing your breast self-examinations every month is going to help you be able to recognize if a difference in your breast occurs. Otherwise, you may not even know. Okay? We're going to wrap up the session by grouping into just a group. You need one other partner, and you're going to assign an accountability sheet, like a contract. You're going to exchange contact information. Whatever's going to be easiest for you to contact that person, whether it be by phone, by text, by email, hit them up on Facebook, however it is, I don't care. I just want you to agree that you will contact this other person every month to remind them to do their breast self-examination. And then I want you to go home and I want you to think about the lesson, and I want you to evaluate all the information that I've given you, so that way you can establish what your own personal risk factors are, and you can come up with some type of a plan to make life changes to prevent these risk factors. And finally, we're just going to watch a short little video. It's kind of comical, and it's just going to help you to remember to do your breast self-exam.